Alright, so now we're going to begin the section on allergies and hypersensitivity. So basically this slide illustrates the continuum related to the immune system homeostasis. This slide 101, if you're just listening, if you want to follow along with the slides. Hypersensitivity reactions are basically exaggerated immune responses that can be uncomfortable and harmful to the patient. Now, there's 4 types of hypersensitivity reactions. They're classified according to the time between exposure and reaction, the immune mechanism involved, and the site of the reaction. So type 1 is immediate hypersensitivity reactions. They're mediated by IgE reaction to common allergies, such as dust, pollen, animal dander, insect stings, various kind of drugs. They can be either local, resulting in local swelling or discomfort, or systemic, resulting in anaphylaxis and possible death if they're not recognized and treated promptly. Now, type 2 is immediate hypersensitivity reactions. Type 2 immediate hypersensitivity reactions are mediated by antibody reactions. Now, they can occur with a mismatched blood transfusion or as a response to various drugs. Now, type 3 results in tissue damage resulting from precipitation of an antigen, antibody immune complexes. They can occur with autoimmune reactions, some occupational diseases, or as a response to various drugs. Now, type 4 is a delayed hypersensitivity reaction, and it results from immune cells migrating to a site of exposure days after the exposure to the antigen. Now, this can occur with contact dermatitis, measles rash, tuberculin skin testing, or various kinds of drugs. Now, hypersensitivity immune function excess is known as hypersensitivity. And this is basically an overreaction. It occurs in response to presence of an antigen or a foreign protein or allergen which the patient has been previously exposed to. The symptoms can range from uncomfortable to life-threatening. It's classified into 5 basic types determined by timing, the patho, and the symptoms, and that you can look on table 22.1 in your text. Now, overreactions are going to be prolonged or excessive inflammation or immune response. It could be also inappropriate inflammation or immune response. So hypersensitivity reactions, type 1 is a rapid response, also known as an atopic allergy. This is the most common type of hypersensitivity. It deals with the production of IgE. Allergic tendencies are inherited, but specific allergies are not. So, mom might be allergic to penicillin, has a child that's allergic to peanuts, but not to penicillin. So a person already sensitized to a specific allergen is re-exposed, triggering the response. So contact with this is usually made through inhalation, ingestion, injection, or in contact with the allergen. Well, this is made up of 2 different phases. There's a primary, 2 different phases of response, a primary and a secondary phase. Now, your primary phase, the allergen binds with 2 adjacent IgE molecules on a basophil or mast cell. Now, this either will break or distort the basophil or the mast cell, and cause a release of vasostrictive anions. This is most common. The most common anion is histamine, and this causes symptoms of pruritus, nasal drainage, redness, lasting at least 10 minutes after release. If it's continuous exposure, then continual release and prolonged symptoms will occur. Now, in the secondary phase, this results from the release of other proteins, bringing in more white blood cells to the area and stimulates a more general inflammatory response. Now, this is in addition to the primary phase. So some type 1 reactions occur just in areas exposed to the antigen, such as in allergic rhinitis or latex allergy. Other type 1 reactions may involve all blood vessels and bronchial smooth muscle in the case of anaphylaxis. So it's important with patients, you want to conduct a history, conduct a physical assessment. You want to ask for symptoms and observe for symptoms. Now, you may draw a CBC with diff because eosinophils will indicate the presence of an allergic response as high as 12%. Now, what is a normal eosinophil count? Okay, if you guessed 1 to 2%, that would be correct. So you're going to see a really high eosinophil count when they're having an allergic reaction going on. Now, allergic rhinitis or hay fever can be triggered by airborne allergens. It is a type 1 hypersensitivity reaction. Now, this could be seasonal, or it could be caused by environmental exposure. It's usually a precipitating factor. Okay, usually it lasts a couple of weeks. Half of all patients with allergic rhinitis have a parent that experiences some form of type 1 allergy. Now, people with this may decide to do allergy testing through a scratch or ID test, which results in, and this usually has results within 15 to 20 minutes. Now, from a scratch test, identity is done when there's a strong suspicion of an allergy. That didn't produce a wheal or a positive with a scratch test. Interdermal testing is usually done when there's a strong suspicion of an allergy that didn't produce a wheal positive with a scratch test. So the degree of the allergy is determined by the size of the wheal. There always needs to be emergency equipment when testing. Usually patch testing is reserved for type 4 hypersensitivities. So when we talk about emergency equipment, we're talking about what? A crash cart, epi at the bedside, okay? So type 1 rapid response, we're going to talk about anaphylaxis now. Now, anaphylaxis is life-threatening. It usually occurs rapidly and systematically. Now, it affects multiple organs within seconds to minutes after exposure. It's not a common reaction, and severity ranges varies, but it can be fatal even with proper medical intervention. A major factor in fatal outcomes is the delay in administration of epinephrine. Now, prevention is critical, so you need to teach the patient to avoid any kind of known allergens, wear medical alert bracelets, tell healthcare providers of specific allergies. Now, epi is given when symptoms appear. What it does is constricts blood vessels, improves cardiac contraction, dilates bronchioles. You can repeat it within 5 minutes as needed. There's other drugs that can also be given. They're listed on chart 22.4. 22.2 also is a list of agents commonly responsible for triggering anaphylaxis. These are usually medications, foods, insects, snakes, other things. Histamines such as Benadryl, 25 to 100 milligrams is a second-line drug therapy given, and it's usually IM or IV for angioedema or urticaria. Now, if the patient is independently breathing, probably going to be put on a high flow non-rebreather mask at 90 to 100% with a goal of having a O2 sat greater than 90%. Now these patients need to be continually monitored for respiratory rate and for depth. You need to be assessing their breath sounds for any kind of bronchospasms, wheezing, crackles, stridor especially. Head of the bed needs to be elevated at least 45 degrees unless there's some type of severe hypotension going on. Okay, and these are the patients that can go downhill very quickly, so they're going to have to be continually monitored. Okay, because their throats can close up really quickly. So you have to listen for that stridor. You have to listen for that stridor because that tells you that that throat is closing up, and you only have a small amount of time that you can put an ET tube if you have to intubate them down. Otherwise, they're going to have to be trached, and that's going to have to be done by a surgeon or, it's an emergent situation. So you want to catch that as soon as you can. Now remember, epinephrine 0.3 to 0.5 milliliters is the first line of defense for anaphylaxis. Here's just a showing you of different looks of what anaphylaxis can do. You see the lady, what she normally looks like and what she does after an anaphylactic reaction. You also see the tongue swelling that can block the airway. Okay, a latex allergy is caused from a specific allergen that's a protein found in processed natural latex rubber products. It deals with the production or interaction with IgE. Now, sometimes contact is limited to where the skin or the sometimes contact is limited to the skin or the mucous membranes, causing a contact dermatitis, which is a type 1 sensitivity, hypersensitivity. Now, some may have a mixture of symptoms of both type 1 and type 4. Now, type 4 deals with T lymphocytes and may take hours to days after exposure to develop. Now, others may have a mixed allergic response with symptoms of both type 1 rapid and type 4 delayed. Now, latex allergies are increasing, especially for people who are in high contact with latex, not Lasix. There's a lot more use of non-latex products to prevent this type of reaction. Elastomite gloves don't contain latex proteins, so you're going to see a lot of people, especially nurses and things, have latex allergies, and there's a lot of non-latex materials available now, especially for patients even. There are, and you have to, when you have a patient that has latex allergies, that has to be noted somewhere in their chart, and also usually they hang a sign in the room to let people know, so they don't use latex gloves, they don't use latex products. Think about if you tried to put so anyways, like I was saying, can you imagine putting a latex, if somebody has a latex allergy, putting a latex Foley in them? It wouldn't be a pretty sight. So there are latex-free Foleys, other equipment. A lot of times now, most companies are making everything latex-free just to make sure that there is no allergy or allergic reaction going on. Now let's talk about food allergies. Milk is not listed on table 22.2 in your text. Milk's not listed. Shellfish, peanuts, grain are among the most common food allergies. An allergic reaction usually occurs within minutes of eating the offending food. Now, symptoms can include asthma, hives, vomiting, diarrhea, angioedema, urticaria. Can be severe. So the person needs to avoid the offending foods altogether. Treatment is usually going to be done with antihistamines or steroids. If it's life-threatening situations, then the epi injection is needed. Now, food allergies are not common. They only make up about 2% of adults and about 4 to 8% of children's allergies in the United States. Now, food allergies differ from food intolerance, which is far more common. The most frequent types of food allergies in adults differ from those in children. So children with food allergies are more likely to have asthma and eczema. Children can outgrow their food allergies, but adults usually don't. So some food allergies can be outgrown. The diagnosis of a food allergy is made with a detailed history, the patient's diary, or an elimination diet. So food allergies are treated primarily by dietary avoidance. Now let's talk, we're going to switch over to type 2 cytotoxic hypersensitivity. Usually occurs when the body makes specific autoantibody against a self cell that has a foreign protein attached to it. The autoantibody binds to the cell. It forms an immune complex and destroys the cell and the attached protein through phagocytosis or lysis. An example would be hemolytic anemia or drug-induced hemolytic anemia from a blood transfusion. A blood transfusion could be that they received the wrong type of blood. Treatment is going to be to discontinue the offending drug or blood product. A lot of times they'll end up with plasmapheresis, which is filtering of the plasma to remove any of the autoantibodies. Otherwise, treatment is symptomatic. So you're going to treat the symptoms. Now, complications from type 2 cytotoxic hypersensitivity can result in renal failure, and as well as hemolytic crisis that can be fatal. Type 3 is going to be an immune complex reaction. Now, this occurs when excess antigens cause immune complexes to form in the blood. These circulating complexes usually lodge in the small vessel walls. So your complexes cause inflammation in vessel or tissue damage. The most common sites are the skin, the joints, SLE is an example of an immune complex. Remember, the symptoms are vasculititis, glomerulonephritis. Serum sickness is a group of symptoms that occurs after receiving serum or certain drugs. Now, your most common cause for type 3 is going to be penicillin or other antibiotics and animal serum-based drugs. Your symptoms are going to be fever, arthralgia, rash, lymphodenopathy, malaise, nephritis, and it usually occurs 7 to 10 days after being exposed to it. Now, this is usually self-limiting and subsides within a few days. Now, antihistamines are given for itching. Usually aspirin is given for joint pain. Prednisone is given if it's severe. Treatment is done symptomatically, so you're going to treat the symptoms. Now, type 4 delayed reaction occurs when synthesized T cells from a previous exposure respond to an antigen by releasing chemical mediators that trigger macrophages to destroy the antigen. This usually occurs hours to days later. Lymphocytes and macrophages collect locally and cause edema, induration, ischemia, and tissue damage at the site. Now, an example of this could be contact dermatitis from poison ivy, insect stings, tissue transplant reactions, sarcoidosis, all those type of things. Now, patch testing is done, and it involves applying chemicals that contain the allergens to which the patient has already been exposed. Patch is usually in place for 48 hours, then the skin is examined for localized redness or swelling and blisters. Treatment is removal of the antigen. Usually self-limiting is done. It's self-limiting and it's 5 to 7 days. Treatment is symptomatic. You're going to monitor the site distal for impaired circulation due to swelling. Benadryl is going to be used. Benadryl is usually not used because of its minimal effect, because histamine is not the main mediator and IgE doesn't cause this type of reaction. So corticosteroids, anti-inflammatory agents can reduce the discomfort. So type 5 hypersensitivity, which is stimulatory reactions. This type of reaction involves excessive stimulation of otherwise normal functioning cells. Now, the surface receptor of the cell is stimulated by an autoantibody excessively causing the cell to be in a turned on state. So if it involves one organ, the treatment focuses on removing enough of the responding tissue or the stimulated tissue to return to normal function. And if the effects are widespread, then the treatment focuses on reducing the production of autoantibodies through the immunosuppression. So an example of this would be like Graves' disease, a condition in which the autoantibody binds with the thyroid-stimulating hormone receptor sites on the thyroid gland, which causes the thyroid cells to be continuously stimulated to produce thyroid hormones, which causes severe hypothyroidism. The thyroid gland is not to blame. The thyroid gland itself is completely normal. It's the tissue responding to the autoantibody that is, in a sense, stuck in an on state. So this system is designed to recognize autoantibody and respond as some sort of checks and balance but it's out of control in this type of hypersensitivity reaction. Now, allergies and hypersensitivity, we'll talk about common allergens. Now, an allergen is an antigen that causes a hypersensitive reaction. The most common allergic condition is hay fever. Diagnostics and medical treatment are done. Long-term medical treatment involves patch testing. If it's identified, desensitization may be used. Injections of minute quantities of the allergen with the dose usually gradually increasing over time. So desensitization is aimed at increasing tolerance to the offending agent and decreasing the severity of the allergic response. Now, medical treatment is usually determined by the specific allergy. Antihistamines are used to combat the symptoms caused by a histamine release that causes the swelling. Bronchodilators are used to open airways. Steroids are used to decrease the immune responses. Topical lotions and ointments are used to resolve the itching or to relieve the itching. Now, nursing care with these, you're going to document all allergies, the symptoms they cause, and any treatment that's currently being used. Now, whenever you get a new patient in, the first thing you're going to do is you're going to ask them about allergies. And you're going to not only ask them what are they allergic to, you're going to ask them what kind of response do you have? What is that reaction that happens when you have these? Some people will tell you they're allergic to a certain drug. They could tell you they're allergic to codeine. And their allergic reaction is that it doesn't make them, they're not really allergic to it. They just don't like the way it makes them feel. Might make them feel on edge or something like that. That's not really an allergic reaction. Allergic reaction is something that, modifies your homeostasis. So causes swelling, causes you to have problems breathing, causes you to become unresponsive, those type of things. That's the type of things you're looking for. Now, you want to know, like I said, you want to document those allergies. You want to know the symptoms that they cause, any kind of treatments that's being used to treat those allergies when they do have an allergic reaction. Allergies need to be posted on the front of the patient's chart and on all the medical records. Never administer a drug that is reported allergy for that patient. Okay? If a doctor orders a medication that they have an allergy to, you need to call back, ask that doctor, say, this patient is allergic to this. Are you sure this is what you want to give them? Depending on what the doctor knows about that, they could change it, or they could say, no, they just don't like the way it makes them feel. I want you to go ahead and give this medication. Now, you also always want to alert the pharmacy of any kind of drug allergies or dietary of any kind of food allergies. And like I said, you always want to notify the physician if there's a contraindication of any kind of allergy to an order that they write. Now, you want to note any kind of correlations that happen, such as people with an allergy to shellfish. They don't need to get any kind of iodine preps. Okay, they're going to have an allergic reaction. Also, anybody that's going to have a heart cath, they don't need to have, they need to know if they're allergic to any kind of shellfish or anything like that. Because the dyes that they put in their body can cause an allergic reaction. Now, more and more patients and caregivers are allergic to latex, so the non-latex gloves are being used more often, non-latex products. Now, patient education is important for all patients. They need to know, have knowledge of the specific things that they're allergic to. They need to try to limit those exposures to those agents. And they need to know the proper use of medications to treat those. So patients at risk for life-threatening reactions such as bee stings, they should wear a medic alert bracelet. They should have an emergency kit available and know how to use it. They're probably going to have an EpiPen on them. Nurses and caregivers should avoid overuse of any kind of personal items such as perfume, deodorants, that also can trigger allergic responses in their patients. So you want to avoid live plants and flowers in the patient's rooms or any other kind of substances that could trigger an allergic reaction. So let's look at hypersensitivity activity. We've got a pretend case with a bee sting that progresses to anaphylaxis. First aid for the bee, wasp, or hornet stings is the first thing you want to do. For anaphylaxis, what are we going to do? Okay, let's look at the definition of a severe allergic reaction. So your mast cells and your basophils release histamines and other vasoactive mediators, which cause circulatory, respiratory, and cutaneous effects. So you're going to treat the symptoms. So if they're having problems, the first line of defense is you're going to do what? Okay, if they're having problems breathing, you're going to raise the head of the bed. You're going to apply oxygen. You want to make sure you give them that epi, because the epi is going to do what? The histamines do what? They're vasoactive mediators. Okay? So what do you want to do with those, the circulatory system? The epi is going to do what? Okay, you need to know exactly what that's going to do. You need to know how to deal with shock anaphylaxis. You need to know how to deal with latex allergy, how prednisone and methylprednisone work, and Benadryl. All those things you need to know about. You need to know how those affect any kind of allergic reaction that a patient might have. Okay, that ends the this chapter, and we will go on to another.